Welcome PsychU community to our interview today. My name is Dr. Carolyn Tyler, and I'm here today with Dr. Raslann Nizar, who's the medical director at the Comprehensive Psychiatric Emergency Program at St. Joseph's Hospital in Syracuse, New York. He's also the vice chairman of the Psychiatry Department there. He's board certified in psychiatry and neurology and is an outpatient service practitioner. Today we are discussing the role of the caregiver in the overall treatment plan. Thank you for joining us, Dr. Nizar.
Thank you for having me. It's a pleasure to be here.
Great. Well, let's get started. Dr. Nizar, can you please describe your current role and setting of your practice?
I practice in a broad range of settings. I work primarily in an outpatient setting where I see patients who are seriously mentally ill. I also work as a medical director at CPEP, the Comprehensive Psychiatric Emergency Program, where we see patients in different settings of illnesses, as well as I also work in an inpatient setting when needed.
Great. Can you tell us more about the importance of the caregiver role in the treatment plan of your patients?
Well, I consider the caregiver role a critical part of treatment for our patients. If you look at broadly the mental illness, patients struggle from a very young age with mental illness, and this lasts chronically throughout their lives, in which they go through lots of different challenges during that time, including the loss of insight in some cases. So for patients to be meeting a new provider who is trying to help them becomes a challenge for them given the struggles they have. So a caregiver offers a great bridge for somebody who they are connected with and who can help them navigate this challenging time of their life.
Great, thank you. Can you also describe your relationship with caregivers, how you interact with them, and what your expectations are for the caregiver and the overall care plan?
Sure. I like to start by meeting the caregivers as soon as I possibly can. Usually in the very first meeting, I encourage families to come and join us, whether it's in the outpatient setting or at CPEP or even in the inpatient setting. I encourage caregivers to come and join me at the very first sessions. And after the introduction, I point out that this is going to be a team. We are going to be working as a team to help this patient. I do introduce the rest of the team who's treating the patient to the caregiver and let them know that we are here with one goal, and that is to help the patient be in a better place clinically.
Thank you. Can you talk about some of the challenges that caregivers face and how they can best overcome them?
Well, caregivers undergo a number of challenges. First of all, having to take care of a patient outside the offices of our clinic is always a challenge, dealing with some of the relapses and acute struggles the patient has. So navigating them, helping them, giving them numbers and resources to contact us, as well as informing them and giving information, as well as connecting them with NAMI, the National Alliance of Mentally Ill, helps the caregiver set some expectations for themselves as well as the patients. And we always encourage the caregivers and the patients to reach out to the CPEP if there's an emergency which they cannot wait until they see us in that clinic.
Okay, and finally, can you talk about some caregiver success stories?
Well, one success comes to my mind when I started treating a patient about a year and a half ago, when he moved from Ohio back to Syracuse to live with his aunt. While he was living in Ohio, he had seriously mentally ill with a mom who also was struggling with mental illness. And he struggled during that time when she and him were struggling with their illnesses, and he went through periods where he was not able to take care of himself. She unfortunately passed away about 2 years ago, and the patient came and started living with his aunt. who reached out to us, and we were able to set some goals, some ideas, first to stabilize him, and then connect with services outside our clinic. And we're very fortunate to say that with the help of his aunt and him, the patient is now employed part-time and is able to be more gainfully happy with some goals to help himself improve. And clinically, he has shown good improvements as a result of working with his closely with his caregiver.
Right. Thank you for sharing that. So thank you, Dr. Nizar, for discussing the role of the caregiver in the treatment plan with the PsyQ community. And thank you for your time and insights today.
Thank you for having me again.